What's the residency in 3 words?
I can think of 2.
Academic.
Intellectual.
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 Inquisitive.
Inquisitive.
Smart.
Challenging.
Experiential.
Flexible.
Creative.
Good-natured.
Transparent.
Collegial.
Supportive.
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 Passionate.
Eclectic.
Eclectic. Eclectic.
It looks a lot like Hogwarts Castle.
Quirky.
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 Quirky is a good word.
Full of surprises.
The word that really comes to mind is family.
Fun.
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 Stupendous.
I feel like U Chicago has the perfect balance of biological and psychodynamic principles.
The University of Chicago at large is referred to as the teachers of teachers.
There's lots of different sites we go to here. There's lots of different exposure. So when you're indecisive, being able to see it all with a bunch of different patients is helpful.
The University of Chicago feels like it has an integration and a responsibility to the community that surrounds it, the south side of Chicago.
I'm very grateful to be a member of this community and to have the chance to pay forward to a new generation of med students some of the teaching and the kindness that was shown to me when I was starting out.
The residency training program is phenomenally stable. I think the leadership is outstanding.
We have one of the greatest universities in the world and a very collaborative university. So if some people are interested in things that are even partially related to mental health, but maybe related to other areas, they can be a part of lectures, they can be a part of training.
There are so many different attendings who do things differently. You can come to this department and really find somebody who has an interest in what you want to learn about and who can really give you that expertise and give you that mentorship. It's not the type of program where they're trying to create you into being one type of psychiatrist. I think our interest is really in helping you become the best type of psychiatrist that you want to be in the way that you want to be that type of doctor.
We do incorporate and integrate thoughts about social determinants of health, cultural psychiatry, and really thinking about how structural inequity can contribute to how we conceptualize and understand mental health and how we actually think about treatments and what those social and structural determinants actually do to impact how patients think about, seek, or understand mental health care.
There is a united sense of purpose. Chicago is the ideal place to do this kind of work. Chicago has wonderful things, but it also has all of the problems that any society would. And so if you're interested in those kinds of problems, this is a great place to be because there are really bright and wonderful people all over the university, different departments, our departments. And so you really feel like you're part of a larger team in addressing these issues of mental health and public health.
So working on the south side of Chicago, the majority of our patients are Black. We like to think, or it's easy to think, that we're here as physicians to deliver medicine and treat people, diagnose them, and move on. But I think especially in the last year in Chicago, especially around the protests of police killings, the whole history of Chicago, there's been a lot of racial tension, but it's really come to the forefront, I think, for a lot of people this past summer. And it kind of drove home the point to a lot of residents that we can't ignore race in these discussions. It is urgent that we become more acquainted with these topics and how they affect our treatment of patients and each other.
It was really exciting and necessary for a long time for the University of Chicago to have a trauma center as like the main only academic center on the south side of Chicago. But since the trauma center has opened, our volume of patients who have experienced physical trauma has increased the mental, emotional, and psychological need. And so I think that's an area where I'm excited to see this institution grow. Because of our volume and the high need of our population, like we are busy. Like, we work really hard.
Most days I personally see between 1 and 3 new patients, and the learning curve has been steep, but I think that just the volume of patients and the kinds of things that I've gotten to see has been really, really awesome.
You can be like so caught up in like the volume and like the number of patients that we have, and like how much they need, and sometimes how much we don't have in our city, in our healthcare system to provide them with. It can become very daunting, but so much of the learning process has been like, how do I advocate for not only my patient, but for myself? How do I stand up for what I believe is right?
The beauty of inpatient psychiatry is that you get to see patients over a very wide period of time, and you really get to know them. And I think the coolest part about it for residents is you really get to see people get better.
And you get to see these very different populations and like what resources we have to work with in each place.
It is kind of a collaborative model, so you're working with your attending, but then also there's medical students with you. There's another resident team with another attending.
It's helpful to have the PRA there to kind of walk you through, how interactions go and what sort of things you can try, and you kind of have someone right there next to you to help you.
What excites me the most about being a training director is meeting 6 people every year who come into the program and watching them develop over 4 years into psychiatrists. Each of them is going to be a very different psychiatrist. There's material that you have to learn, but everybody also, ideally, learns to use themselves as a vehicle for that learning and becomes a psychiatrist using their own personality, their own interests, and pursues an area that they really love. So I think that that's the point of training, is to help people figure out what direction they want to go in and support them as they really go for it.
I love how the residents really challenge us. The diverse patient population that we see, each case is so different. And residents push us, within the institution, within the systems that we work in, as well as with our patients, and it's great.
I think one thing that surprised me was how much I learned about myself. It's been 3 years so far in this residency, and I feel like I'm a lot more self-aware and sort of attuned to how I learn and how I interact with people.
The University of Chicago does a really fantastic job at making sure that their residents are well.
I liked the idea that there was a kind of more formalized mentorship arrangement.
We're assigned mentors from day 1 or even -1. We speak on the phone or meet in person, and we kind of just talk about what was difficult that week, what we want to process, how they can help us shape our goals, what opportunities they know that are around that they can link us to. And then first year we were also set up with like a 4th year buddy and a 2nd year buddy, and I felt extremely supported my first year.
It's a really nice time to kind of unload some of the emotional burden that you have moving into residency. It's also nice to have someone to kind of keep you accountable, providing you with journal articles, making sure that your clinical interests are being met, and then being able to advise you as well.
It's a mixture of having a friend, having a mentor, in some ways having an unofficial therapist.
I form a relationship with that trainee over a 4-year period. And it's a relationship that starts out in one place and ends up someplace totally different.
We try our best to pair people up with faculty that they have some interest in the areas that they work in commonly. And for me, I've had great experiences with just connecting with residents through this role, being able to listen to them as a faculty member, but also someone who has just recently finished residency and understands the struggles that are unique to residency, and really being able to hear them.
The mentoring in the department is really at a top level. I think it's mentoring without being sort of parenting. So I think it's actually done I think in a very supportive but sort of a very equal way, in terms of, I think that the faculty see the residents as peers and therefore want to help them as colleagues.
I definitely have felt very listened to as a resident each of the 4 years.
You have like group therapy with your other residents because it's a difficult time and there's going to be things that are unforeseen that come up.
I love process group. I just love being in the space with this particular group of colleagues.
We all meet every couple of weeks and talk about the process of becoming doctors, becoming psychiatrists, and really we talk about anything at all. And it's very helpful for a lot of reasons.
Yeah, I think that has been like as important a part of my education than as some of the like very, very clinical specific stuff.
I was a little nervous about coming to such a small program that I feel like the interpersonal dynamics had the potential to be a little more complicated, but everyone I've worked with has been really amazing. And I have really loved all of the other interns and really everyone I've gotten to work with.
And everyone's very down to earth, but yet very like passionate and like about psychiatry and ready to geek out.
COVID has been a challenge for everyone, but I think our department weathered everything really well.
And even when, COVID isn't necessarily something that we think about in psychiatry as we have to deal with it, it definitely had a huge impact on how the unit was ran, because I didn't think about how like groups couldn't be as effective and like visitors weren't going to be a thing. But then I went to CL and you learn new ways to interview people and kind of how to make your skills work in any type of environment.
There's all sorts of ways to get involved in research, but I think at essence, you identify during your workday what makes you happy. The second step is, trusting your mentors, trusting your teachers, because they're really there to help you, not to tell you what to do, but to show you where there are pitfalls or things that might not work or will work. If you do those two things, all of the details like statistics and software and learning about research methodology, those are really quite secondary and quite actually basic, surprisingly.
There's both old data that residents can examine and ask questions of that we haven't yet, as well as seeing sort of scads of folks coming in who are research subjects who actually are quite different from clinic patients often. And I think it just makes a better clinician out of many of the residents if they know where their interventions are coming from and the data that supports it.
A few of my co-residents and I recently got funding from the department to launch a new research project, and I think that goes to show how seriously the department takes trainee scholarship, and I'm very grateful for the opportunities to be involved in research.